Hello and welcome to my YouTube channel Enlightening Medicos. I am Dr. Akshita and today we are going to discuss about another important national health program NVBDCP. NVBDCP stands for the National Vector Borne Disease Control Program. The NVBDCP is an umbrella program for prevention and control of six vector borne diseases, which are malaria, filariasis, dengue, Japanese encephalitis, kala azar, and chikungunya. So in this video, we are going to discuss about the different strategies of NVBDCP at the center, state, and district level. What are the milestones of NVBDCP? In 1953, it was NMCP or National Malaria Control Program. Then in 1955, the National Filariasis Control Program and National Japanese Encephalitis Control Program. After that, in 1958, National Malaria Eradication Program. Then from 1990 to 91, National Kala Azar Control Program. In 1996, National Dengue Fever Control Program. In 1999, National Anti-Malaria Program. From 2003 to 2004, National Vector-Borne Disease Control Program. And in 2006, Chikungunya Control Program. What is a vector? A vector is defined as an arthropod or any living carrier that transports an infectious agent to a susceptible individual, and the transmission may be biological or mechanical. Mainly arthropods are the pathogens which transmit flies, sandfly, lice, fleas, ticks, and mites, etc. Mainly mosquitoes. NVBDCP was launched in 2003 to 2004 by the Ministry of Health and Family Welfare in the Government of India, and it is an integrated component of National Health Mission. It has three organizational levels: the central level, the state level, and the district level. We are going to discuss about each one of them one by one. So let's talk about central level. The NVBDCP Directorate is responsible for framing the technical guidelines and policies, budgeting and planning the logistics, monitoring of the implementation of program. It carries out evaluation of program implementation from time to time and assessing the resource gap and providing equitable support. So this is at the central level. Now let's talk about the state level. At state level, every state has state vector-borne disease control component under the Directorate of Health Services. So who are the people responsible for conducting it? Number one, Director of Health Services, and number two, State Program Officer with different designation such as the Director or Joint Director, which each state has established. Now let's talk about at district level. The district malaria offices have been established under district chief medical and health offices by states. It includes the district malaria officer or district vector-borne disease control program officer, then the assistant malaria officer and the senior malaria inspector, which is the key unit for planning and monitoring of the program under a technical officer. What is the mission statement of NVBDCP? It's the Integrated Acceleration Action or IAA towards reducing mortality on account of malaria, dengue, and Japanese encephalitis by half, elimination of Kala Azar by 2010, which is yet to be achieved, and last but not the least, elimination of lymphatic filariasis by the year 2015, but it is 2024 and we are yet to achieve it. Let's talk about the program objectives of NVBDCP. Number one, surveillance and outbreaks. Number two, early diagnosis and prompt case management. Number 3, vector control through community participation and social mobilization. Number 4, prevent the mortality due to the vector borne diseases. Number 5, reduce mortality due to vector borne diseases. And number 6, elimination of Kala Azar and lymphatic filariasis. What are the program strategies of NVBDCP? Number 1, NVBDCP strategies. Number 2, partnerships. Number 3, technical support as well as logistics. Number 4, improve the efficiency and quality of the services. Number 5, monitoring and ensuring program implementation. Number 6, environmental management. And last but not the least, the focused attention. We'll talk about each one of them one by one. So basically, the program strategy of NVBDCP includes three-pronged strategy for prevention and control of vector-borne diseases, integrated vector management IVM for transmission risk reduction, then disease management including early case detection and complete treatment, strengthening referral services and rapid response, and last is the behavior change communication, public private partnership, and human resource development. So let's talk about the disease management, early diagnosis and case detection, prompt and complete treatment, referral services strengthening, and the epidemic preparedness and rapid response in the case of any emergency situation. So, in this way, overall, we can take the following steps to manage the disease. Number 2, integrated vector management. For the transmission risk reduction, we can do indoor residual spraying or IRS, example by the DDT, dichlorodiethyl trichloromethane, malathion. Number 2 is the use of insecticide treated nets. Then we can use LLIN or long lasting insecticidal nets. We can also use larvivorous fish like guppy and gambusia, etc. Now, indoor residual spraying, the insecticides in use are malathion, DDT, synthetic pyrethroids like deltamethrin, and cyfluthrin. So, these are the different chemical insecticides which we can use for the indoor residual spraying. What are the space sprays? These insecticides instantly kill the adult mosquitoes with no residual effects. The space sprays must be repeated often, at least once every week. Pyrethroids, example deltamethrin, are commonly used. Now, what can be the supportive interventions in this? Behavior change communication, as I told you earlier, public private partnership, then different sectors integration, that is intersectoral convergence, human resource development, monitoring evaluation, vaccination for the Japanese encephalitis, web based, internet based management information system, and the annual mass drug administration. So, these are the different simple steps which we can take which can prevent the transmission of different vector borne diseases. These should be integrated. Then partnerships by the other national health programs like non-health sector department, civil society organizations, then corporate sectors, medical academia and professional bodies. Then technical support is also required as well as the logistics. It is provided by the government of India, and we have to improve the efficiencies and quality of the services at three levels: primary level, secondary level, and the tertiary level. Now, one by one, we will discuss about these levels. So, let's talk about the primary level. ASHA under NHM National Health Mission, Anganwadi workers of ICDS Integrated Child Development Services, and community volunteers of NGOs, non governmental organizations, will be trained to serve FDT or fever treatment depots. Then, of course, PHC, CHC are equipped to manage the Plasmodium falciparum malaria, which is also known as malignant malaria, and lab surveillance enhanced program. Secondary level means training by medical officers, lab technicians, and community volunteers of the public and private sector. District level hospitals equipped with ventilators and lab services. And then, last but not the least, is the medical audit. That is, medical unit should be ready to serve 24/7 whenever there is any emergency situation. So, this will be the secondary level, which will include district level hospitals. Tertiary level, the medical college hospital to manage all referrals and undertake therapeutic efficacy studies of Combipack and effectiveness for rapid diagnostic kits, RDTs, rapid diagnosis for management of severe malaria cases. So, it is the main tertiary level, the last referral unit, third referral unit, and it's the highest of these all after primary and secondary. Monitoring and ensuring program implementation by the state government, environmental management by proper drainage and sanitation to reduce the prevalence of mosquitoes and reduce spread of JE, then focused attention, center and states monitor the program closely and high risk areas are identified for focused attention. So what are the different conclusions? Demand and supply of the vector control measures need to be maintained and research should be promoted in the area of drug resistance, resistance of mosquitoes to chemical sprays, and more effective control of vectors. Thank you so much for watching the video and I hope you liked it. Please like, share and subscribe to my channel and I want you to share it to maximum people as much as possible. And I took a lot of efforts to make this video. These are my personalized notes. Thank you so much. May God bless you. Have a nice day.